Hello and welcome to this episode of Community Connections, airing right here on OROMIA11. Today we are talking about breast cancer awareness as well as cervical screening with Sage Plus programming right here with the Minnesota Department of Health Representative Bonita Robinson. This is going to be an episode that you won't want to miss. Please grab someone in your network that can benefit from this information. Grab a pen and a pencil too, or a piece of paper so that you can jot down a few notes so that you can find out as best and as early as possible about your opportunity to get a hold of cancer. This is going to be an episode you won't want to miss. Very special welcome to you on today's episode of Community Connections, Miss Bonita Robinson. How are you?
I'm blessed. How are you?
I am wonderful. Now today we are talking about breast cancer screening and cervical screening through the Sage and Sage Plus cancer control screening program for the state of Minnesota.
Yes.
Now, can you talk to me a little bit about what Sage is and the Sage Plus program is?
Yes. So the SAGE program has been around since 1991, and what the SAGE program covers is cervical cancer screening and breast cancer screening for women between the ages of 40 and 64. Mm-hmm. Some women are totally uninsured, so they have no insurance at all, but some women are underinsured, meaning they have insurance, but the deductible is very high, or they have excessive amounts of copays. And we do have an income criteria as well, based on 250% of the federal poverty level.
That's so important because, as we both know, breast cancer and skin cancer are still the leading cause of death for women around the world. And according to the Center of Disease Control, upwards of 42,250 people are expected to pass away from either one of those.
Yes, and we're trying to do what we can to prevent that as well, much as we can.
Now, you've said since about 1991, SAGE has been doing the work of cancer screenings here across the state for women.
Yes, so since 1991, we've screened about 180,000 women, detected about 3,050 cancers. We have an internal call center. I'm one of the navigators at the call center. We're experienced in helping women with evidence-based interventions. We partner with about 430 clinics throughout Minnesota. We have some stark racial disparities, especially with women of color. And our 5-year survival rate is about 25% less than Caucasian women in Minnesota. We've covered about 7,000 breast and cervical cancer screenings annually, about 2,500 women who have insurance. We help them navigate to screening programs. Sometimes they don't know what their insurance covers or how to access screening services. So we work with women uninsured and underinsured.
Now let's talk about that underinsured word. For a lot of people that may have coverage, like you said, there may be a gap where it doesn't cover some things, and then people are still shouldering a really large bill.
Right.
And trying to figure out ways to cover that while they're already fighting for their lives.
Right. So with the SAGE program, if she meets our income guideline or age guideline, and she might have a $2,000 or a $3,000, $5,000 deductible, means she's really not covered because she would have to pay all of that before her insurance would kick in. And so that's where the SAGE program can come in. Or some women have insurance that covers the preventative screening, but then if they need something more diagnostic, then that's what sometimes the insurance doesn't cover. And sometimes we can enroll a woman, mid-cycle or retro-enroll her if she's had some screening already and needs more services.
Now, so many of us often go to the doctor and we have insurance plans and we don't know what covers what. And then cancer usually hits us like a ton of bricks or hits our family like a ton of bricks. And then you're still trying to navigate your own treatment plan on top of trying to figure out where extra money is going to come from to now take care of such difficult bills. This program is really necessary. Now, you all have a new shift taking place as of February 1st, 2024. Can you talk about what that is?
So previously we were able to help women schedule programs or screenings if they were under the age of 30 or over the age of 65. Some of us, I'm 65, are not Medicare eligible yet, or we haven't gotten into Medicare. And so some of the women that are younger were able to access our breast screening services. But now, with the changes in February, we cannot screen the younger women for breast services if they're under the age of 30. If they are 30 and over and have family history, symptoms, and things like that, then we can help them.
Okay. Now, can you share with us what the next SAGE screening event is taking place, as well as what takes place at these events for women that may, or for people that are interested in coming and not only finding out if they do have breast cancer or cervical cancer, or if they just want to know more information about what the metrics are?
So we're working with the Stair Step Foundation, and we're working with some of the community churches, local churches. So September 21st, at St. Peter AME Church, we'll be having the Park Nicollet mobile mammography van. Also, October 12th, they'll be in 2 locations, Greater Mount Vernon Missionary Baptist Church and True Foundation Church of God in Christ. And October 19th, we're working with North Point Health and Wellness. They're the only federally qualified healthcare clinic in the Twin Cities that has on-site mammography. We're going to do a breakfast and breast event on October 19th. So those are just a little bit or a few of the ones that are coming up in the next month or so.
Those are some very important dates for viewers. I hope that you all are writing those down and or replaying this episode so that you can come out and hear more about the work of SAGE and the SAGE Plus programming so that you are able to get the breast cancer and cervical cancer screenings. Now, I want to talk a little bit about number breakdowns because you just shared you guys have partners of 450 clinics across the state aiding you guys in this screening process every day, which is really powerful. But let's talk about diagnosed cases, people you all have screened, things like that, so that we can start to get a better scope on, one, what our state is looking like, but also how much good work you guys are actually taking care of.
So annually, about 7,000 breast and cervical cancer screenings are covered. We navigate about 2,500 women to services. About 85% of the population are women of color or African American Indian, 40% of the population of the patients we get through SAGE are because we have a reminder system that we send out reminder letters and remind women that they are due for their screening. I know I appreciate a reminder. And so a lot of the women have been in the program before, also word of mouth. If I have a screening and it's, and I'm happy with it, then I'll tell my neighbor about it, et cetera, et cetera.
Those are really powerful number breakdowns because you think about how close cancer is coming. Either you've dealt with it or someone you know has dealt with it. For me, it's my mother as a cancer survivor, and you're saying the same. And I just look and I'm like, we have to stay on top of this. Prevention is definitely key, but it is also life-saving.
It is.
So it is my hope that someone watches this episode and finds the information that they need to talk to their doctor or to sign up with you all for the services that you guys are offering. Can you talk to me outside of what you just said about your mother, about what keeps you personally connected to this work?
Well, I lost my mother when I was 20 and she was 46. And so I always think about the programs that we have now that we didn't have 40 plus years ago, the screening services. And every time I, hear of a woman that might have gotten screened and if she had cancer and was caught early, she survived, or if we could lighten the financial burden for her or things like that. And every time I'm at a community event and I can see maybe 2 generations, it might be a mother and a daughter, such as myself and my daughter, getting a screening. And it's just part of my passion. I feel like it's one of the callings that's on my life, is to help women navigate through services and get the services that they need.
I think that's very powerful. Now, you said that you all are a part of a network of 450 clinics. You guys are working in partnership with Stair Step and some other churches coming up. Can you just share or maybe give a special shout out to some of the other community partners that you guys have in the area? Because I think people may not be familiar with your program, but they may be connected or aware of some of the other existing community partners.
Okay, so we work with the American Cancer Society, the Breast Cancer Education Association, the African American Breast Cancer Alliance. We do some work in the Somali community at the Bryan Coyle Center. And then we also work with the Lao Assistance Center, getting those women screened for breast and cervical cancer as well.
I think that's very powerful. Now, for those that are interested, how do we stay connected to the work of SAGE and the SAGE Plus program?
Our number is 1-888-643-2584.
Thank you so much. Are you all on social media at all?
The Minnesota Department of Health is on social media.
Okay, and we'll be able to find you guys under
Yes.
the SAGE and or SAGE Plus program?
Yes.
Wonderful. Lastly, I just want you to look directly in that camera and just give a word of encouragement and a call to action for someone that is hesitant about finding out what their status is regarding breast cancer or cervical cancer.
All right, so we want you to act now so that you can be there for the future generation and you can be there for yourself. I'm Benita Robinson, SAGE Plus Navigator. Please get your screening so that you can be there for yourself and for those who depend on you. Our number is 1-888-643-2584.
That's wonderful. Ms. Benita Robinson, it has been a pleasure talking to you about the work of SAGE as well as SAGE Plus. And I know that you mentioned breast cancer, working with the Breast Cancer Alliance, and we want to send a very special shout out to the amazing people over there doing the work. We have had their CEO and founder on this program as well, talking about the work. And as we head into October, we have to definitely make sure that we are getting our mammograms and doing our best to get screened in advance so that we are not one of those 42,250 supposed deaths to breast cancer this year, according to the CDC. I see that you have your pink on. Is there anything that you want to share about people in regards to breast cancer and taking care of that?
Just making sure that you get your screening. Some women are nervous about getting mammograms because they say it's uncomfortable, and it may be a little bit uncomfortable, but a picture can save your life.
That is the absolute truth. Thank you for joining me on this episode of Community Connections. Unfortunately, that is all the time that we have for this amazing episode. I hope that something shared today you have found educational, inspirational, and or interesting and has perked your ear to talk to your primary care physician or reach out to the amazing people like Benita Robinson at the SAGE Plus screening program and find out about your status in regards to breast cancer and or cervical cancer. As always, I am your host, Anna Orr, and this has been an episode of Community Connections. I look forward to connecting again with you soon.